Home First is a transition management philosophy where we focus on moving people from, after their acute care stay in hospital, we really focus on moving them home. We focus on treating the person in hospital where they need to be treated and then moving them back home and making decisions about where to next from their home environment.
So that requires every discipline that's engaged with the patients to talk about home as is where we want you to go. We want to get you through this hospital stay safely and in a timely manner and discharge you home if at all possible. And we're going to make every effort as the team to do that.
We have increased our level of service, and so we now offer a very, very robust short-term transition plan that people can really be supported to get home on, and then we look from there where they need to go. And when we look at that number of people who have used that transition plan, that intensive hospital to home plan, that number is upwards of 450 now. So since we began, so that's about 18 months ago, we've diverted. All of those people would absolutely have stayed in hospital and waited for long-term care, and we've diverted that number of people across all the different sites.
With the Home First philosophy and the changes in the community resources and the phenomenal work that CCAC has done to realign the resources, we've been able to safely discharge patients home and prove in a lot of cases that they can stay home safely with appropriate levels of support. And a couple of years ago, that wouldn't have been something that most patients and our families would have been able to consider.
When we look at the success of Home First, the CCAC and the hospital are working together to achieve that success, and without each partner it wouldn't happen.
It is about partnerships across the healthcare system, and this project in and of itself has, to me, proven that we can do it, that we need to be persistent with each other and hold each other accountable, but when the patient's the center of why we're doing what we're doing, then anything's possible.
That's the biggest success. It's not about patient flow, it's not about ALC rates, it's about the patients and actually seeing them transition home and say, I'm so glad to be home.